Good morning, everyone, and thank you for coming today. Welcome to the Child and Adult Care Food Program, CACFP 101 for childcare programs. We want to make you aware that today's webinar is being recorded and broadcasted live to Facebook Live as well. The Child and Adult Care Food Program is a federally funded nutrition assistance program for young children, as well as school-age students and elderly residents and others. However, the child care portion of this program provides nourishing meals to young children while also instilling lifelong healthy eating habits and helping to develop their socialization skills. Although CACFP has grown in recent years, there are still many unserved young children who would benefit from this nutrition assistance. Since we are unable to directly interact given this webinar format, we would like to have all of you complete a few polls throughout the webinar. If you are joining us via Facebook Live, you will not be able to participate in the interactive poll questions. However, please feel free to submit your answers in the comment section on Facebook. So today's webinar is a collaborative effort between Hunger Free New Jersey, the Reinvestment Fund, the State of New Jersey's Department of Agriculture, Healthy Kids, Healthy Future, and the Robert Wood Johnson Foundation to provide an accessible format during this pandemic because we wanted to make sure childcare programs could access this program easily and learn about the basics of CACFP. So you can see today's agenda. We're very excited to have our guests from our collaborative organizations, and we'll introduce them as we get to their portions of the agenda. But today, my part of the presentation, so during the pandemic, all types of childcare faced many challenges, as we all know. And through our outreach efforts from ACNJ, we learned that many childcare programs show new and renewed interest in CACFP, and therefore we collaborated to present today's session. So if you could go on to the next slide. Okay. So we know that childcare has always been in crisis. We didn't have a system that was that had enough funding and supports to begin with. However, when the pandemic struck, Governor Murphy declared a public health emergency in order to mitigate some of the worsening spread of COVID-19. And that played a significant role and made the crisis more critical and multifaceted for childcare. Then, as we know, in April, due to an executive order, licensed childcare centers were approved and directed to exclusively serve the children of essential workers. And we know that about 565 at the time out of 4,000 centers were approved to be emergency centers. However, during this time, no directives or guidance were provided for registered family child care providers. But we also know that a great majority of registered family child care providers also remained open and continued services for the children in their care. And we know, as I mentioned, that prior to the pandemic, childcare was already a sorely underfinanced and unaffordable system for families and where workers were receiving low pay. During the pandemic, however, I wanted to talk a little bit about how we found out that more providers were interested in CACFP. So to amplify the voices of childcare providers, ACNJ advocated for additional federal childcare funding and to educate our members of Congress and senators. And we were able to organize congressional meetings with the entire congressional delegation except for one. And you'll also see that we provided a 3-part webinar series for providers, as well as a 3-part webinar series for parents to really understand how providers were feeling in the beginning of the pandemic, what the parents' needs were throughout those early stages of the pandemic. And then later on, we had a webinar series focusing on the reopening of childcare, because as you all know, Governor Murphy signed Executive Order number 149 that reopened childcare centers as of June 15th. And at that time, the Department of Children and Families, as well as the Department of Health, released released guidance outlining the requirements for reopening. And so through those requirements, we then had another webinar series that went over some of things such as creating a blueprint for reopening and operation readiness, employer rights, and getting your staff back to work, because these were issues that we were hearing from the field that were important to them. But largely where we heard a lot from our providers were surveys. Throughout this pandemic, since March, we've issued a series of 5 surveys, 4 with childcare providers and 1 with families. And we had over 900 responses to those 4 provider surveys. And what we found so significant throughout those surveys was not only the things that providers were facing, however, they were also extremely concerned about the families and their care. And we know that one of those needs that we're faced and continue to be faced is the need to provide nutritious meals and snacks to families, and to have that food accessible to the families and children that are participating in childcare. Can you go on to slide 3, please? So just really quick, because we know we have an audience of quite a few providers today, we want to make sure, and we'll have this, as I said, the webinar is recorded, and so you can access these resources now or at another time, but we wanted to connect you to resources because we know this is so important. You'll get a lot more resources from our great partners throughout the presentation, but I wanted to bring your attention to specifically the Department of Human Services Division of Family Development's website. That is childcarenj.gov. They have a series of grants and resources and programs that are available to providers and to families to benefit your program during this time. But also community and statewide organizations are really important during this time as well, such as your local CCR&R, your Child Care Resource and Referral Agency, your Grow NJ Kids Technical Assistance Centers, and other professional organizations like the New Jersey Family Child Care Providers Association and the New Jersey Association for the Education of Young Children. Both of these groups, as well as these organizations, are there with resources and ways to support you during this critical time. So now we will turn it over to Adele LaTourette, the Director of Hunger Free New Jersey, to do her portion of the presentation.
So I am the Director of Hunger Free New Jersey, and I just want to review kind of what we're all seeing, what we're facing on the front lines, and how CACFP can really help, along with other federal feeding programs, sorry about that, along with other federal feeding programs, to really address the issue, the critical issue of hunger in New Jersey. Next slide, please. So in 2018, we had about over 219,000 children experiencing hunger, and that's according to Feeding America's Map the Meal Gap. That's about 11.3% of all New Jersey children. As we all know, childhood hunger, all hunger varies greatly among counties, from about 9% in Hunterdon and Somerset to about 18% in Atlantic and Cumberland. Next slide, please. Feeding America estimates that New Jersey will see a 75% increase in hungry children due to the pandemic. That's the 5th largest projected increase nationwide. Now, part of the reason for that is that relative to other states, we were low in terms of our the rates of hungry children in our state, but still, it's a staggering number, and one that, again, we all need to figure out the best ways to address. Next slide, please. Hunger Free New Jersey leads the Food for Thought campaign, New Jersey Food for Thought campaign, and the goal of that campaign is to reduce childhood hunger, with the focus of doing that being on key child nutrition programs. So that includes school breakfast, summer meals, after-school snacks and summers, SNAP, and the Women, Infants, and Children Feeding Program. So all of the programs that really focus on reducing hunger in general and childhood hunger specifically. Next slide, please. That campaign was launched in 2011 and really has had a significant impact on childhood hunger and what that looks like in New Jersey. So we've seen a 65% increase in school breakfast, a 36% increase in summer meals since 2015, and in terms of suppers, a 34% increase since 2016. The school breakfast number is since 2010. That's really where we were doing so poorly, and we've just made such great strides in that area. Next slide, please. but we're still missing tens of thousands of children. In 2019, New Jersey communities reached just 6% of eligible students with after-school suppers. This is an area where we know we can have a really big impact with your help. And again, what we have to keep in mind is that everything we can do to offset the issue of childhood hunger, we really, at this point, it is critical that we make all the efforts that we can. Next slide, please. We're also missing out on federal dollars, and New Jersey is one of the states that reclaims very few of the dollars that we give to the feds. So if we served the recommended 15% of eligible children, communities would collect an additional $20 million in federal funds each year to feed hungry kids. We cannot deny the impact that this amount of money will make in our communities and how desperately it's needed, especially during the pandemic. Next slide, please. So reducing childhood hunger, as they say, it takes a village. It's a community effort. CACFP is open to schools, community organizations, child care centers, and local government agencies. And that's what it takes. It's going to take everyone coming together to address this issue. Next slide, please. Again, expansion of child nutrition programs is the key to success. I have been having weekly phone calls with emergency food providers throughout the state of New Jersey, the key providers, and what we know from speaking with them directly is there is no way they can keep up with demand, particularly at this point. And we need, again, to focus on expanding federal feeding programs. CACFP provides generous reimbursements for suppers served to children in low-income areas and should be a key piece of a community's anti-hunger efforts. Next slide, please. Again, more federal dollars. If we reached the nationally recommended 15% of eligible children, New Jersey communities could collect an additional $20 million each year. That is from Hunger Free New Jersey's Our State of After School Meals Report in 2019. Again, more federal dollars, feeding more kids. This is a win-win proposition. I hate that term. Sorry, I just said it. Next slide, please. CSC helps kids, families, providers, after-school meals, help children who might otherwise go home to an empty dinner table. Again, especially now, we need to focus on doing everything we can as communities to increase the amount of food that kids have the ability to get onto their dinner plates, and families, what families can do to maximize the amount of food coming into their household. CICFP helps struggling parents, again, dealing with these tight food budgets. We know the rate of unemployment. We know what we're seeing in the state. We need to do everything we can. Next slide, please. We work through Hunger Free New Jersey in local communities to help build coalitions, make connections to effectively expand programs. We have a small but really key outreach team, Lisa and Brad, and they, some of you may know them. They have been on the phone, they have been doing webinars, they've been having coalition meetings throughout the state of New Jersey, really focusing on expanding access to federal feeding programs, CACFP, school meals, and others. Next slide, please. We publish annual reports at Hunger Free New Jersey on child nutrition programs and other topics. You can find those resources at hungerfreenj.org to learn more and get involved. You can reach out to us. We are here to help you in whatever way we can with the capacity that we have. Again, our focus is making sure that in every community throughout the state, we are expanding and increasing access to all the federal child nutrition programs, to SNAP, to all the programs that are out there, and are very happy to, again, answer any questions and happy to have been invited to participate in this webinar. So thank you so much. Next slide. That's how to reach us. Please, again, feel free to reach out. And again, thank you for inviting Hunger Free New Jersey to join this webinar. Thank you.
So now we are very pleased to have Jacob Roche, the Policy Solutions Researcher at the Reinvestment Fund, who will review a mapping of current childcare CACFP participants in New Jersey.
Great, thank you very much, and thank you again for having me. Like she just said, my name is Jacob Brosh. I'm a researcher with the Reinvestment Fund. If we go to the next slide. Great. So Reinvestment Fund is a CDFI. That's a community development financial institution. That means that we're a bank with a public purpose. We make loans and grants in all the things that communities need to be healthy, thriving places, whether that's housing, education facilities like childcare facilities, healthcare, food access, and many other areas. So CACFP school meals is a topic that an area that we're very interested in because it's sort of at the intersection of two of the areas that we're really focused in as an organization. So what I'm going to talk to you about today very briefly is specifically the slice of CACFP that many of us on the webinar today are really interested in, which is that slice of CACFP of child care centers participating in the program. And just going to review some of the data about where providers in the state are currently, child care providers in the state are currently participating in CACFP, where we see shortages and the need for expansion. So let's go ahead and go to the next slide. So what you see on the slide here, it's a little cut off on the bottom. On the right is a map of every child care provider in the state of New Jersey that participates currently in CACFP as of August. And across the state, there are about 1,300 child care providers that participate in the program currently. Most of those providers, about 85%, so that's 1,100, are centers. But a substantial share of the participants in CACFP are actually family daycare providers, about 220. Most of them have a capacity to serve about 50 to 100 kids, so they're about moderate size. Most child care providers participating are sort of moderate in size. Let's go to the next slide. So one of the things that we're particularly interested in at the Reinvestment Fund is expanding access to these programs, and particularly expanding access in low-income and disadvantaged communities. And so what I've shared with you on the slide here today is a little bit of information about where we see shortages in CACFP across the state. So the map on the left side of your screen speaks to how far families have to travel to get to the closest child care provider that participates in this program. And so what we did is we looked at the location of every child care provider that participates in CACFP, and we looked at where low-income families in New Jersey live, and we looked at the distance there. So those dark brown parts of the map are places where families have to travel over 5 miles to reach at least one, to reach the closest CACFP provider. So one of the good things we see is that across the state of New Jersey, there are certainly some areas where there are shortages, where families would have to travel a really long way just to get to even one provider. But many parts of the state, families, particularly low-income families, don't have to travel very far to find at least one provider that participates. We estimate that 69% of low-income families, low-income children who are childcare age, would have to travel less than a mile to reach a CACFP childcare provider. But about 8,000 low-income children under the age of 6, so who would be eligible for childcare, live pretty far from any CACFP participating sites, over 2 miles. So this speaks to how far families have to travel to get to a childcare provider that participates in this program, but doesn't really tell us much about shortage, right? Because you may be close to a provider that participates, but they may be full, you may not be able to afford them. So if we go to the next slide, this is really a sort of simple analysis that we conducted to look at where there are shortages in capacity for CACFP. And so the way that we defined a shortage in capacity is we looked at the number of providers who are participating in CACFP, number of childcare providers participating in CACFP within 5 miles of every census tract in the state. And 5 miles, that's about depending on traffic, 20, 30-minute drive. So that's probably, in our experience, about as far as families will typically travel to go to a childcare provider. So we looked at how many providers were within, a 5-mile radius of every tract. We looked at how many low-income families, low-income children who are childcare eligible, so low-income kids under the age of 6, are in every census tract. And then we looked at the ratio of kids to providers. And so here on this map, those dark red areas are places where we see shortages in CACFP capacity, where there probably aren't enough childcare providers to serve the number of low and moderate income kids in those communities. Many parts of the state, seem to have relatively modest amount of capacity, but we see a number of sort of dark red areas which indicate that high shortage. Across the state of New Jersey, we estimate that about 12,000, little under 12,000 low-income children are living in these high shortage areas where there aren't enough child care providers participating in CACFP to serve all the need in those communities. So with that, I'm going to turn it over to Stephanie, who's going to tell us a little more about the CACFP program.
Thank you, Jacob. We are very pleased and excited to have partnered with Stephanie Mullen. She is the coordinator of CACFP from the State of New Jersey Department of Agriculture, Division of Nutrition. And she, as Jacob mentioned, is going to review the CACFP eligibility requirements, how to apply, basically everything, and how to get started.
Thank you, Dani. Thank you so much. I am Stephanie Mullen, the state coordinator for CACFP in the state of New Jersey. It's not advancing. Come on. Here we go. I'm very grateful to AC&J and Hunger Free New Jersey, and especially Dani Glover for the opportunity to present CACFP to you today. Really, in light of this critical time in our state and on our state's history, and then also with the mandated state closures. Apologies, it's forwarding on its own. There we go. That when I found out that only 161 of our sponsors were emergency childcare out of the 565 emergency childcares, I knew something. We had to take action. And today I think is a really good step in identifying what CACFP is and breaking it down for the eligibility requirements and what it takes to apply, and really what the reimbursement looks like, what you're eligible for to help build your food program. The 6 goals, which kind of piggybacks off of what Adele has shared. The why you want to do this, why do you want to take this on at such a critical time period? Really, obviously reducing food insecurity. More and more parents are unemployed right now and really are having trouble putting nutritious meals on the table. Alleviating poverty, we talked about, because you're going to provide these meals free of charge to the parents. We're going to improve nutrition. We know that. We're going to get some healthier outcomes together. Obviously, we're going to protect against obesity. There are meal pattern requirements for what do we serve? How do we create a menu? We're going to work on boosting learning and child development. A child can't listen, learn, or behave if they're not well nourished. And then lastly, kind of the big focus right here, right now, especially with the funding that is available, as Adele said, that we're leaving on the table, is to support economic stability. And stability for our families by not taking any more of their family budget, because they're going to have meals during the day at your centers, and also by adding funds to the budgets of the sponsors for how to build a sustainable food program at your center. All right, so we're going to cover these topics today. What is CACFP? Do you want to be a sponsoring organization, or a site? And what does that mean? What does that look like? Eligibility requirements, and that's eligibility for the sponsor, the meals, the participants. We're going to touch on those meal pattern requirements. We're going to look at what reimbursement could be. And then we're going to talk about the 7 steps to applying for CACFP if you want to be a sponsor. And then partnering with sponsoring organizations if you want to be a site. And then the fun part of CACFP, that farm to preschool, where you get to integrate some really fun growing in gardens and all sorts of different things. And we obviously have some USDA resources and some state resources for you. All right, so again, the Child and Adult Care Food Program, it's a federally funded child nutrition program for children and adults. And it's a program of the Food and Nutrition Service of the United States Department of Agriculture. And it's available to all eligible participants, regardless of race, color, national organ, sex, and disability or age. And it actually has been around, this is from the 50-year celebration, but it's actually been around for 52 years and probably one of the most underutilized programs in our state. And the history of how it's gotten along, this is kind of a good snapshot, but it started back in 1968 and has built to what it is today. So I'm so glad we have this opportunity to really take a look at what this program can offer you. Obviously, there's regulations, the USDA policies and state policies, and these really help us to guide through what we can do. Every food program that you're going to develop is going to be different. And, this gives us the how we can do it and the what we can do. All right. This is our non-discrimination statement. The USDA takes civil rights very seriously, and there's a lot of benchmarks and requirements for non-discrimination in your food meal service. All right, so this is kind of give you an idea. The USDA provides the funding to the state to also disperse that eligible funding to sponsors. And also they train us, they monitor us, and then we train and monitor you. All right, so in FY 2019, we had total participation, that's between children and adults, of over 97,000 participants per day, which is pretty good, but still not good enough. And there were over 44 million total meals served, and reimbursement for the year was over $87 million. So we know that we will even, as Adele said, to piggyback on what she said, we could, if we're reaching 15% from the 6 to that, we can get up to, well over $100 million. All right, so when is meal reimbursement available? Child and Adult Care Food Program is available 365 days a year. And we'll talk about the individual programs that operate. The only one that is a school year-based program is that at-risk after-school meal program. So we have CACFP has many complex programs and many programs that are available to you, just to let you know of when participation can take place and when you can serve meals. All right, so let's talk about who's eligible. And we're going to start with the institution eligibility. We have private nonprofits who are participating, for-profit centers, public schools, private schools, government entities, municipalities. For a nonprofit, that does require federal tax exemption, so you would need a 501c3, and it needs to be currently federally tax exempt. For profits, we would need to see a copy of your certificate of incorporation or in formation. And there's also for profits, CACFP is the only child nutrition program that does allow for-profit participation, which we think is wonderful. And there is a 25% free and reduced participation that's needed. So you do need to have 25% of your enrollment meet that free or reduced, or you do need to be receiving that 25% Title 20 or child care subsidy. So if 100 of your participants are out of 100, if 25 are receiving a child care subsidy, then you would be eligible. All right, so this is what it would need to be for a sponsor for you to be eligible. Okay, so the sponsor, like we said, you take on administrative responsibilities. You have to have additional funding sources. You prepare or you purchase the meals. You take on the bulk of the administration of the program. All right, so you can sponsor affiliated sites. So if it is a ABC Daycare and they have 3 locations that are all ABC Daycare, then they can participate under a nonprofit or a for-profit. For our unaffiliated sites, you want to sponsor your own sites as well as some of the community sites, the USDA regulations require that only our nonprofits are able to do that. You can also be a family daycare provider, sponsoring organization of home providers. We have 11 currently in the state. We're definitely looking to expand. They're in every county, but we're looking to expand. And just please note that family daycare home providers are not eligible to actually be a sponsor, okay? So what does that site do? They're going to serve the meals. You're going to report daily participation. Okay. Family daycare home providers, they're actually preparing and purchasing meals, serving them at home. They maintain the menu, report participation. Look at those happy faces, record keeping. They're fully trained by the sponsors on what is needed and what takes place. Okay, so here's kind of a list that would show you the difference between what it would mean if you were a sponsor. So the sponsor maintains the sponsorship. They're administratively and financially responsible. They have other federal funds or other public funds that are available to them, maybe a grant. And then they would be receiving the reimbursement if they're sponsoring sites. Big difference. If they are a sponsor of family daycare homes, they distribute the reimbursement to the providers. All right, and they would be eligible for administrative fee, which we'll talk about in a few minutes. The sponsor would determine the eligibility applications that the participants complete. They would prepare or purchase the meals, and then the training and the monitoring of the staff, the sites, the homes, that would be the responsibility of the sponsor. So they are kind of the parent of the program. They have to take care of all the responsibilities, and they are, like I said, financially and administratively responsible for the sponsorship once you apply. The site, on the other hand, and we do have a lot of childcare that will just come on as a site initially to kind of get their feet wet and see, they would be provided meals to serve to their children. They're going to report attendance, which you already do for your licensing requirements. You're going to record those meals so that those can be claimed. You're going to gather the eligibility applications, post the menus, serve eligible meals. We'll talk about that in a minute, what that means. You have to serve at the approved times, and your sponsor will let you know. You would attend trainings, and you also would participate in 3 monitoring visits, at least 3 during the year. All right, so that's a good comparison of what each role would be. All right, so let's talk about the type of sites or homes. So child care center sites we have 2 programs. We have a preschool meal program and an infant preschool meal program. They both require a child care license. Our outside school hours program, that's one of our after school program for up to age 12, and that would require a license as well to participate. We do have licensed emergency shelters, and some of them will participate as a sponsor, and sometimes you might be the sponsor of an emergency shelter. And we know that our family daycare homes, most of them are registered with the state as a registered family daycare home provider. We have some military family daycare providers, and then our at-risk after-school meals program. If you do have a license, then it would be a child care license, it would be applicable. And if not, all at-risk after-school programs would provide an attendance zone letter showing that you're in the attendance zone of a school that has 50% free and reduced lunch participation. We would need a copy of your certificate of occupancy to see how many children you're allowed to have in your building, and then a copy of the fire certificate showing that you have had a current fire inspection. All right, so those are the type of sites that you could sponsor or that you could have on your food program. All right, so as I mentioned, there are age limits, regulatory age limits, the child care program. So obviously you would be licensed maybe 0 to 6 for a preschool or an infant program. That would be for those 2 programs, 0 to 6. Outside school hours is up to 12. There we go. Family daycare is also up to 12. At-risk after-school programs has a very wide range. That's all actually up to age 18. So we'll see that maybe in our elementary schools, our middle schools, and then even our high schools can participate in that program. We have many after-school community programs that provide for up to that age. And then there's the emergency shelters, which is also 0 to 18 years old. All right, so now you're thinking, all right, can I be a sponsor? Can I be a site? The sponsor, you have to be fully capable to operate independently of our funding. You're not charging for meals. Parents are not paying you for the meals. They're being provided at no charge to everyone, irregardless of their eligibility category and the reimbursement you receive. And you're making a commitment to your community, to your families, to provide healthy meals and increase food access in your community. And like I said, I mentioned you are required to have additional funding sources in place. All right, so I'm not going to go through all of these documents, but this is just kind of an idea of the information that you would need to have in place, and we will help you, my staff and I will help you through this process of what these records mean and what would be needed to put them in place. As this slide shows, every day you'll be doing something for CACFP, daily record keeping for attendance and meal counts, that weekly menu, monthly, I gotta get your monthly records together so that you can get your reimbursement claim in and maximize, your reimbursement for those eligible meals. There's annual eligibility applications and staff training, and then obviously there's ongoing monitoring. So if you're a sponsor, you're going to monitor your sites, and then if you're a site, you're going to be monitored and participate in that experience. All right, so who's going to be eligible? As the pictures on the side show you, every institution sponsor sets it up a little bit differently. It might be a group working together on their program. Everybody takes a part. You might have one person doing the claim and one person does the menu. We require a primary person that's going to be our contact. Then you also need to have a substitute person. And I don't think, during this time period, we've had so many staff changes that we're seeing that we're even recommending putting a few more people in place. But it could be any way you set it up. Sometimes we're talking right to the owner. Sometimes we're working with an administrative assistant. It's who you decide is going to be responsible for the program. All right, so we've talked about the goal is to improve the diet for enrolled and at-risk children up to from infancy. We do have an infant program up through 18 years old, and through the provision of this supplemental reimbursement. All right, so we're going to talk a little bit more about the reimbursement part. So child care centers can be reimbursed. The family daycare homes, the home providers receive the reimbursement. And then we have the after-school programs. Schools, through the at-risk program, can have meals and reimbursement for weekend and school breaks. And then we have reimbursement for the meals in the child care center. The emergency shelters. All right, so for the child care programs, they are eligible to be reimbursed for 2 meals and 1 snack per day per child. So that would be for the infant meal program, preschool program, that outside school hours for the school age, and then for the family daycare homes. At risk is 1 meal and 1 snack per day per child. And then the emergency shelters, they're actually able to be reimbursed for 3 main meals. So at the emergency shelters, most of our sponsored shelters will provide breakfast, lunch, and dinner. All right, so these are the meal types, and then there are the USDA meal pattern requirements. So you would need to provide a credible milk, grain, fruit, or vegetable for breakfast. AM snack is any of the 2 food components. Lunch would have the 5, the milk, the grain, the fruit, the vegetable, and the meat. PM snack is again any of the 2. Dinner is the same as lunch, milk, grain, fruit, vegetable, and a meat. And then the evening snack can be any of the 2. All right, so this is kind of an idea if you had a preschool program in place and you were serving a breakfast, a lunch, and a snack to your preschoolers who were there all day, and then your after schoolers got that dinner up at the right-hand corner. Looks pretty good. Okay, so let's talk about the reimbursement. How am I going to pay for these beautiful meals? There are 3 categories of reimbursement. So free is our highest rate of reimbursement. That's for your most needy participants, your most needy children. Reduced is for needy children. It's slightly lower. And then for the paid. So it's the paid category, but it doesn't mean that those children pay for meals. It just means that they're least needy. All right, because we're going to remind you that we're not charging for meals. These participants, you're providing these meals for free. The lunch and the supper, you'll see there's a footnote there. They can, for every lunch and supper, you can have the option of receiving cash, an additional 24, it's down that bottom, 0.2450. So you would get an additional almost 25 cents for the lunch or dinner that you served. And added, if it's for that free, it would be $3.75 and change. All right, so the reimbursement is pretty generous to provide a nutritious meal to your participants. Now, these rates are for centers, all right? Family daycare has their own set of rates. Tier 1 would be the most needy, and that is based on school data, census, and the provider's income level. And then tier 2 would be for anyone that would not be area eligible based on those three. All right, so for here, a little different. The reimbursement goes to the family daycare home provider. You'll see down at the bottom is the administrative fee for the payment that the sponsor of the homes receives. That initial 1 through 50, so they're receiving $120 a month per home to provide the administration and the financial responsibility and the sponsorship to those providers. And they are responsible to provide the reimbursement to the providers within 5 days. All right, so we talked about the tiering requirements, and we teach you all about this in training and what's needed, and each home is set up based on the tiering for the tier 1 for the area eligible data. And then if they are tier 2, they can utilize the family daycare home eligibility application. All right, so for this, we're going to base our example in a second on centers. This is a snippet of an eligibility application that your participants, your parents will fill out for each child, and it has their enrollment information and all their financial information. And they are completing this once per year based on the income scale to the right that changes. They have to be redetermined each year because the income scale does lower. And then who you may have had a child that was eligible for reduced meals last year and is now eligible for free meals instead, which means more reimbursement to sustain your food program. All right. There are categorically eligible categories, which means that automatically these children are going to receive the free meal reimbursement rate, the highest rate of reimbursement. There are most needy children in the state. You do not need an eligibility application for these children. So this would be for our at-risk meal participants, our Head Start children, our foster children, our TANF and SNAP household children, and then any child residing in a shelter. They're our most needy, and there's not an eligibility application required, and we're going to reimburse those meals at the highest rate of reimbursement. All right, so here's our budget example. We talked about who's eligible and what meals we can serve. Now we're going to look at an example of what's this going to cost and what can I be reimbursed. So the example is for 100 enrolled participants. 30 are determined in the free category, 30 in reduced, and then 40 in paid category. So if they participated for 20 days, and that's normally the days of the month, around 20 days per month, they are going to have a morning snack, a lunch, and a dinner. You can see that the free participants for the month you're going to receive for those 3 meals, $4,788 for your reduced participants. The 30 reduced, you're going to get $4,020. The paid, you're still going to get a few pennies, but you're still going to get almost $600 for them, $592. And then all of the lunch and dinners, the LDs here, the lunch and dinners that you serve, you're also going to get that additional 0.2450 on top of the reimbursement rate. So that was another $980. So for this 100 participants, serving them meals for 20 days, a morning snack, a lunch, and a dinner, the monthly reimbursement estimated reimbursement would be $10,380 for the month. All right, and then if every participant participated every day, that the annual reimbursement that you would be eligible for is over $124,000. So we like to talk about this part so that you understand the funding that's available and what that looks like and how you can implement that in your program. We do provide, sorry, it's not advancing. Oh, there we go. We do provide a budget. So this is kind of a snippet from the budget where you can see all of the meals that were claimed, the total number of days, and then the reimbursement rates, and the 30 free, 30 reduced, 40 paid. So it did equal to reimbursement of $9,400. That cash in lieu we talked about, that extra funding you get, $980. And then as part of your application, when you apply, this is the actual budget. You're completing this to see how much reimbursement you'll receive. And then the second section on the bottom, you are able to estimate what your food costs are to see if this is something that you can take on. So for here, the snack was 65 cents. The lunch, the average cost was $2.20. And then the dinner was $2.25. So we know that total reimbursement for this month was $10,380. It's going to cost, the food edible portion is going to be $10,200. So you actually have $180 left over for some of your administrative costs. All right, and that's very typical that we do see the reimbursement will most often, don't quote me, but most often cover your edible food cost. All right, so now let's talk about what it takes to apply for a CACFP new institution application, new sponsor application process. There are 7 steps, all right? And how I'm often asked, how quickly does it take to get approved? And that really does depend on the turnaround time for the requirements to be approved, based on how quickly you complete them or how quickly you'll submit the information that's needed. All right, so we conduct an initial outreach survey to find out, are you eligible? Sometimes we have a brand new childcare and they're not licensed yet. So remember I said you had to be licensed, they would not be eligible. We might have someone that is for profit and can't meet that 25% for-profit eligibility requirement. It might be a nonprofit that isn't currently federally tax exempt. They only have state tax exemption. So we don't let you go through the end of the application and then say, oh, by the way, you weren't eligible. Right then and there, we get to know you and what you want to do and help guide you through the process, and then help get you those business requirements in place before you're able to apply. All right, so if you are eligible, then there's a pre-registration process where you are going to submit all of your business requirements, find out if they're in order, things that are needed to participate in this federal child nutrition program. You're going to complete required trainings. So there are required trainings that are available virtually, and then now we've converted our in-person state trainings to webinars, I'm very happy to say. So you'll complete all of those, and you do need to participate and gain a certificate at the end, and there is a requirement to pass the quiz at the end with an 80% to proceed. Okay, and they're very good trainings, and you'll really enjoy them. After you complete trainings, you're going to get an agreement number and access to our online application. So that's part 1. The second step for your application would be to submit some outside of the system required documents that are federally required. Once you've gotten that far, we're going to do a pre-approval visit. And that's really to provide some additional technical assistance. When we're allowed to do them in person, we will come to your sites and watch your food program in place. You're already starting, you're taking attendance and collecting meals and serving meals. And then we will also provide any additional guidance at that time. And once you're pre-approval visit is approved, then we will have a final approval when all 6 steps are reviewed and they are complete, and you will be approved. Okay. And our email is down at the bottom. So what does all that look like? Outreach, it's really just getting to know you. Who are you? What do you want to do? What do you want to do with your CACFP program? We will give you a business registration and application procedures packet, which outlines all of the business requirements, all of the training that are needed. These are the business records, and we put this at the front of the application process because this is where a lot of our sponsors, it does take quite a bit of time sometimes to get some of these things in place. So getting us a copy of your 501c3 or your certificate, we need to know, information about you as a legal business entity. You'll need a DUNS number and a system award management registration. So this is through the federal government. It does take 4 to 6 weeks to do that. So if you want to be a sponsor, we want you to start that process right away. You'll be required to complete a New Jersey START registration, and you'll receive a vendor ID number. And this is so that we can pay you from the state. So federal funds pass through the state, and you have to set up with the state so that we can pay you. Obviously, if you're doing business in the state of New Jersey, you have a business registration certificate. We'll receive copies of all your child care licenses, your registrations for your family daycare providers, copies of your sanitation certificates. So to feed the public, you have to have an inspection by either your local or state health department with a current sanitation certificate says that you're equipped to do so. And then there are CACFP performance standards, and there's a questionnaire where you have to complete to ensure that you are viable, financially viable, organizationally accountable, and then lastly, administratively capable. Okay, another consideration for becoming a sponsor, are you going to self-prepare meals? Do you have a full-service kitchen? Or are you going to need to have vended meals and get a vendor? All right, there's required contracts for that, and you have to put a menu in place. You'll be completing a menu as part of your application. Self-preparing meals. So if you want to do that, you call your local health department. They'll come out and ensure that you have what it takes. The basic requirements are on the side of having a refrigerator, a freezer, stove, sink, dry storage area, and then obviously that sanitation certificate. If you're going to need a vendor, so you're going to have to go out to bid or have a small purchase contract, maybe you might be getting meals from a local school. There's a whole process in place for purchasing and how you can use your federal funds. Okay, so these required trainings, and these are things that maybe you might want to do before you think if you're going to apply. These are available. Our state webinars will be available at our state website on the left. And then the core training and the ICN, Institute of Child Nutrition, those are both funded by the USDA. So the core trainings, CACFP Operational Resources and Education, they will give you a good idea of what it's like and what the requirements are for being a sponsor. The ICN, the Institute of Child Nutrition, they have so many resources. They have a civil rights training, they have meal pattern training, infant meal pattern training. There is so much information out there that's available online. And obviously we have the USDA resources we'll talk about in a little bit. But there are required trainings that you'll need to complete from the state webinars, core, and ICN, the Institute of Child Nutrition. And you will be required to receive a certificate and achieve an 80% or above. All right, so if you've gotten this far, you're on step 4. All right, so once you complete your trainings, you sent in all your business requirements for the pre-registration, you're going to get an agreement number and access to our online system. You're going to complete your application online. And then there are some additional records that are required outside of our system currently that you'll need to submit. And once all of that is approved, now sometimes it takes a little back and forth where you'll send some things in that aren't approvable. We'll ask for some corrective actions. And then, you might just have questions, which we will answer as well. Once you have your applications in place, there will be pre-approval and then final approval. So let's see what that looks like. This is a glimpse into our current system where the application, all those documents on the side there is about 23, I believe, currently, where you'll need to complete in the system. Some are their entries. Sometimes you're uploading your information. You're filling out information for every site you have, or every home provider you have. And then the required documents, these outside are currently at our website. So those are documents that you would need to complete. And also email to work with our specialists so that we can get you approved. Okay, once all of that has been completed, we will do the pre-approval visit where we will, right now we're doing them virtually through a webcam like this or a Zoom. And we will observe your records that are maintained. We'll take a look at your kitchens. We'll observe a meal service to see that the meal pattern is being met and served at the appropriate time, approved time. And then this is probably the favorite slide. Once all of those steps have been taken, you will receive final application approval. And I'm sure you'll be feeling just like she is. You'll be excited to be approved and start reimbursement. Very important to remember that reimbursement starts in the final month of approval. Once you've gotten through the 7 steps, we do not give back reimbursement from when you first started. It's when you've submitted all the documents. And some of our sponsors will get through maybe in 2 to 3 months, and some are taking a little bit more, maybe 3 to 6 months. But just to kind of give you an idea of the steps that are needed. And we are there providing technical assistance, emails, calls, whatever's needed to get you through to this happy, exciting time of being finally reimbursed and finally approved for your application. Once you are approved, there is a renewal every year. We do have to renew your application to make sure everything's current. Your SAM's registration expires, your license is expired. So all of that would need to be updated as part of the following year and every year to come. All right, so are you ready to apply? If you're ready to become a sponsor, that's the email address. You can send over a request for more information right now. The SurveyMonkey link for each will be on our website shortly. And you can also call, even if you just want to get some information. We have some sponsors who will take all of the trainings first and kind of plant the seed right now that they want to get started. And they might plan to start in January, or even some start early enough that they're starting the following September. But we know it's really important right now to get as many childcare centers sponsored with this federal reimbursement coming through for meals that we want you to apply as soon as you're ready. All right, so if you're thinking at this point, I'd rather be a site. I want to try and see what it's like first and see what the requirements are at the site level. Every food bank in the state does participate in CACFP, and they are our regional sponsors where they will take on those unaffiliated sites. You will talk to, we have some of the best CACFP sponsors on the panel. Some of our experience have been with us very long, and they have very good compliance level, and they have really good experiences, and they ask wonderful questions, and have expanded in their communities, which is really very impressive. And if you are a family daycare provider, we can connect you with a sponsor that is in your area that will train you and monitor you and get you set up quite quickly. Sites can be, pretty much be set up maybe within a month or so. So it's an easy way to start getting nutritious meals in your sites. And then we do have those large nonprofit sponsors of unaffiliated within the community. They're also willing to take on some new sites. So there's an opportunity to go through the new sponsor process to apply. And then if you want to start fairly quickly and just receive the meals and do the attendance and the record keeping of the meal count, this might be a way for you to go. One of the fun parts of CACFP is our Farm to Preschool program. The department has you can see this is our copy of our website. So we have Farm to every part of our programs, our nutrition programs at the department. We have a page just for Farm to Preschool, which does give additional resources, and these are from the USDA, the National Farm to School Network. what does it take to get started. There's a lot of good information here. There's a lot of good coloring books and games, and a lot of our child care sponsors are actually, if you're doing nutrition education or teaching about meals in a classroom or growing, tomato plants in a styrofoam cup, you're doing farm to school, farm to preschool. So there's a lot of ways to expand it, and children love and are more encouraged to eat those fruits and vegetables if they grow them. So a lot of good opportunity and resources there for you. Our website has a multitude of links to resources and resources there as well. And that's our email address and our phone number and our web address for you. The USDA also provides a they just updated their website. They have one just for participants and providers. They have videos, YouTube videos. They have interactive games. They have meal pattern, team nutrition, a lot of resources to really implement your program and put it in place properly. All right, and obviously there's handbooks. We have a lot of good researchers who like to read the handbook and see what we can do and what we can't do, and there's a multitude of those available at the USDA website as well. All right, so I just want to thank you for the opportunity to present CACFP to you and to give kind of a little snapshot of what's going to take to become a sponsor, or if you want to participate as a site. We have sponsors stay. We have very little leave our program once you get on, and many will say that the new institution application process is the toughest. Once you do it you get a system in place every month at your program, and we feed, breakfast 9, 12, and snack at 3. Got our records in place. It's much easier. So I'm encouraging you all to apply and become, if you're not sponsors, and if you are participating, thank you. We really need you. I appreciate it. And thanks again for AC&J for the opportunity to present.
Absolutely. And thank you so much, Stephanie, for all of that great information. Certainly only the Department of Agriculture can provide. So we are so very fortunate to have a panel of child care programs who participate in CACFP and are going to speak about their experiences participating in the CACFP program to give you a real idea of how it works. And we have 2 family child care providers as well as 2 licensed centers. And the panel today is going to be facilitated by Suzanne Cornell from the State YMCA Alliance, Healthy Kids, Healthy Futures. And our panelists today, just waiting for the slide to come up. We have Khadijah McQueen, the Director of Food Access at the Capital Area YMCA, a licensed child care program in Mercer County. We are so fortunate to have Orlean Cummings, a registered family child care provider from Essex County. Shernette Frey Palmer, also a registered family child care provider from Passaic County, as well as Teresa McKay Booth, the Senior Director of Child Development at the Cumberland, Cape, and Atlantic YMCA licensed child care centers that represent Cumberland, Cape May, and Atlantic counties. So thank you, ladies, and thank you for Suzanne for facilitating this panel.
Good morning, everyone, and thanks for being here. Thank you, Dani, for hosting this, and thank you to Stephanie Mullen. That was a great presentation and so much information for those who want to get started to provide meals to the children in New Jersey. So just going to start right out and ask you some questions. The first one is, can you provide some examples of how participation in CACFP is a value add to your program? So what does it bring to your families? What is the benefit, and how is it a value add? And I'm going to start with Orlean because you're in the top corner of my Zoom panel.
Good morning, everyone. As was told, my name is Orlean Cummings. I'm an in-home provider in Essex County. I've been a part of the food program for close to 10 years. And I do believe it's a very valuable asset to my program because I am in the South Ward in Newark. So the families I work with are experiencing a great deal of economic difficulties. So the fact that they know they don't have to provide the meals for their child or children when they bring them to my facility is definitely a plus. It enhances my ability to market my program to families, because sometimes families come to me because they don't have the time to pack a lunch bag in the mornings before they drop off their child. So to know that their child is going to be with me for the next 8 to 9 hours, and during that time, those children or child will receive nutritious meals, and that my meal program is monitored by the state, helps my parents to feel very, very comfortable.
Great, thanks. And Teresa?
Hi, I'm Teresa Booth. I'm with the Cumberland Cape Atlantic Y, and along the same lines of what Orlean just said, we have 68% subsidized parents in our programs, and face it, today, even with COVID on top of it all, life's crazy, and for a parent not to have to pack breakfast, lunch, snack, it's so easy for them. And to know that we are providing nutritious meals, I think that that just adds to our programs. It adds to the programs, you're adding to the community in large, because you're teaching the children the best way to eat, as well as serving them the nutritious meals. So you're putting that taste in their mouth.
Great, thank you so much. And I'm going to go move over, and certainly Shernette and Khadijah, if you have something more to say about value, please do so. But can you describe, I'm going to kind of segue in because Teresa brought it back, what is the level of satisfaction from of the meals from the parents' point of view, the children, even the staff? Are they eating it? Do they enjoy it? Could you comment on that? And I'll go to Shernette.
Good morning, everyone. Thank you. Okay, my name is Shernette Frey Palmer, and I run a 24-hour family daycare here in Passaic County. I've been with the program for almost 15 years, and I must say that it's really a benefit to the families. It's been a benefit also to my own personal family, because having a guideline to work with, it has really helped us sustain a healthy diet. To be honest, working with this program, with the food program, has also helped me in my daily life with losing weight, because of the food, the meals that are provided and that we're introduced to and we're able to maintain. It's really been a benefit. I've even brought nutritionists from 4Cs to come in and do training with the parents, and they're so ecstatic when they come in, because they learn so much. And not only is it helpful for the children, beneficial for the children, it's also beneficial for them. So it really is a major impact on the families. And like Miss Arlene said, it helps the parents to have a peace of mind. They don't have to worry about bringing in meals. They don't have to consider, what is my child going to eat? Is my child going to eat healthy? They already know. They're aware. And we do provide the parents with a copy of the menus. If something is going to be substituted, we let them know, but they know that it's going to follow the guideline. So it's really been an amazing asset.
Great, thank you. And Khadijah, can you comment on that also?
Yeah, sure. Good morning. My name is Khadijah McQueen. I'm the Director of Food Access for the Capital Area YMCA. Currently, we have 2 affiliated preschool programs and 1 unaffiliated. We have at-risk programs from local city government to school-based after-school programs, church programs. One of the things I like to get the children involved with is the menu. So, you just want to teach kids how to eat healthy, and allowing them to plan the menu. A lot of kids, I had one child say, I don't want these trees, and you have to educate them on this broccoli. So just having different facilities stopping by, and of course before COVID, just to ask the kids, and even now under the waiver, you can do grab and go meals. Still, communicate with the facilities and ask them, what are the kids like? Because, we have multiple sites, multiple facilities. Each site would not like the same menu. So it just created a diverse menu, communicating with the parents, and, giving information, literature to take home to parents to even bring it inside of their homes to have a healthy family setting, a meal.
Great, thanks so much.
You're
And
welcome.
I'm just going to move along. And you were talking a little bit about educating families and how we can support healthy eating at home. So I'll go back to the rest of the group to talk a little bit more about how it helps you educate not just the children but the families, and how it's made changes in their home, and strategies you use to help shape those nutrition and healthy eating environments. So I'll go back over to Arlene now. Yep, you're still on mute. You clicked. There you go.
I apologize for that. The way that it works for me, I have to share a little bit of my own background. I'm actually from Guyana. So what I do is a lot of the foods I cook are Caribbean in South America in terms of the cuisine. There's a lot of fruits and vegetables. So what I use that as an opportunity is it's a teaching moment for me. And so what I have very young children who are coming here from maybe ages 1 all the way up to 13. So what I do is I make it a fun activity. And what I do is I teach the children about the importance of vegetables, how it strengthens their bones, their teeth. It helps them to learn how to think and how to play. So it's not just about eating things that are healthy, that taste good, but I show them the connection to their body and its development. And parents love that. When I have activities that include my parents, we have these same conversations where even if they might be resistant to it because they're like, oh, my child does not eat vegetables at home, I show them ways that we can maybe add a little bit, maybe a type of seasoning to make the vegetable a little bit more tasty. So it becomes a communal thing for me. And that's how I get parents and children involved in terms of how we shape their view about eating and the importance of eating healthy.
Great, thanks so much. And Teresa, can you comment a little bit more on that? I know you do some family workshops in your area. And also, if you could think about, and as I move to Shernette and Khadijah, how it has helped educate your staff and how they've been able to be better role models for your children.
That's been an interesting progression. Actually, with the education piece, it kind of came about a while ago. I mean, we've been doing this program, at least from my perspective, 14 years. I know it's been greater. When I had gone with our new vendor, everything came in whole grains and reduced sugars. And, we recently went to no-fat milk. So it's kind of been a progression. And, at first the staff were like, there's no way the kids are going to eat this. They're going to look at the colors and they're not going to like them. And it's not what they get at home. And I'm like, give them a chance and be that role model. Don't say, oh, I wouldn't eat that. It's like, oh, that looks yummy, So it was kind of a little bit of a culture change instead of saying, okay, they won't and making an assumption. So we went along that progression. I actually talked with the vendor to get more fruit because off season he was serving fruit cups. And this is where my education piece came in for the parents. Parent called me livid. You're the YMCA. Why are you serving fruit cups? You got syrup in this and everything. Well, case in point, my vendor, it's fruit in a cup. There is no added sugar. There's no syrup. It's just fruit in a cup. But again, that's when I realized the parents needed that education. So then from that point, we start putting more in the parent handbook about the food that we were serving. We were doing social media posts. This is what we're serving today. This is what the benefits are. Then we start doing some family nights where we were teaching the parents how to do some different quick and easy healthy cooking. We opened it up to the whole community, as not just our parents. So we're trying to think outside the box because obviously it's great to have that in-house with the children, but when they go home, it's not going to be changed unless the child's very outspoken and saying, oh, this isn't healthy. So gradually, we're kind of getting that word out and trying different areas and venues in order to get that word out. But we send it home in newsletters. Any little tidbit we can send, we send. So I hope that answered your question. So.
Yeah, thank you so much. And Shernette, could you comment on family engagement and promoting or how it benefits the nutrition and eating behaviors for the families and the children?
From my standpoint, it definitely does benefit the parents. And as far as family engagement, our families are very much engaged in every aspect of what we do. And a part of that is the reason why we have offered the trainings, where we do have someone come in and we all sit down and we all learn together. So the parents understand it's not only for them, it's also for us as well. On top of that, because just like Orlean, I'm also Caribbean, I'm from Jamaica. So a lot of the foods that we provide are from the Caribbean. So therefore, it's like a lot of times the parents come and they see us preparing certain things and they're like, oh, can we get some? And we don't have a problem. We do not have a problem saying, sure, why not? We'll pack a little plate and they'll take home, and they're taking home for themselves and their child, because in all fairness, a lot of the parents are coming home from work, they're exhausted. They've had a long day, they're exhausted. So if if this is a small part of what we can do to assist them and know that the children are going home to a healthy meal, no problem. So we also engage that way, as well as if they say, listen, how do you make this or how do you make that? We offer them also. And now with the Zoom, it's so beautiful because, we can be like, okay, let's do a Zoom call. And while we're doing this is what you need to be doing, So that's basically what we've been doing as far as family engagement.
Great, thank you so much. Sadisha, I don't know if these were on some of the questions, so I might be putting you on the spot, but if you could talk two things about best practices when identifying or working with a vendor, and maybe then tail off a little bit to, we haven't talked about school age meals. So could you comment on what you're doing at the Capital Area YMCA? But I would like to comment on vendors and how to work with them and to get the diets that you want.
Sure, no problem. So, best practices for vendors definitely have great communication. I talk to my vendor definitely. We actually do a menu for each program. Like I said, we had, before COVID, about 14, 15 unaffiliated at-risk programs. And so we planned a menu for each, facility. Like I said, it could be a diverse group of children, and each facility, the children, might want separate things. Some kids might want Taco Tuesday or different things like that, something healthy. And so just having communication with the vendor, definitely know, increases and decreases, have that, where there's 24-hour, 48-hour, so you can communicate that information to your facilities as well. So just great communication, maybe call in once a month, maybe everything don't have to be over email, just so you can have an understanding and far as menu items and what's coming in and can they get different things in. So, my best practice is definitely communication. That's key. Make sure that you're in the rate for the meal, snacks and lunch and dinners is a reasonable rate, because you just want to make sure that you have that administrative to pay your staff. So you don't want to go over a rate with a vendor and it's over the pay rate for the reimbursement, So, that's the key. That's best practices that the Capital Area YMCA uses. The next question was
just to comment a little bit about the school age of feeding the snacks, and if you do any dinners, I'm not sure.
Right. So like I said, the diverse means for school age, we do dinner and snack for our at-risk facilities. Like currently now we're doing grab and go. A lot of programs are doing remote learning and kids still need that dinner and snack. You know, it's like I said, I still communicate with the directors of our unaffiliated at-risk programs and say, hey, what are the kids like? You know, if you can take 10 minutes and just plan a menu, you know, around that. We have, like I said, Taco Tuesday, and it's like, you know, what do you guys want today? Or, you know, do you want Meatloaf Monday? And, you know, just having that communication with it. And like I said, every program doesn't have to have, you know, the same menu. You know, in one area, it might be a Hispanic population, in another area might be another one. So they might have different tastes, you know, and just allowing yourself time as a sponsor to create that menu for them through CACFP. And that's one of the bonuses with CACFP is designing the menu.
Great. Yeah. Two more questions in this speed lightning round. Is if you could change one area about CACFP, what would it be?
Definitely the area eligibility. You know, I know a lot of programs, especially during the pandemic, you know, they've reached out like, hey, you're doing grab and go meals. You know, how can we be a site, or can you tell me more information? And it's just like check-in for at-risk, you have to have an attendance zone letter, you know, or you have to be above that 50 percentile, and you check a facility and you know the need is there, but they're a little bit under it. And so if we could just kind of waive that, you know, or, you know, and the license for a program. During COVID, a lot of programs are not at their facility, but at-risk programs, you have to have that occupancy. And so with 75 children there and they're doing 100 kids virtual, you cannot plan 100 meals for that because you're over your, you know, allowed daily meals for that day. So that's one or two of the things I'll change, especially during COVID. If you have 100 kids virtual and your license is 75, you're going to have 75 meals for that day in the area eligibility to support other sites that definitely want to serve dinner and snack to the communities.
Thank you. And Shernette, anything you would like to change and why? Oh, you're.
Yeah. I think the only thing I would probably change is the rate. I think the rate of pay is probably the rate of pay, and as far as instead of paying, a lot of the foods are a little bit more expensive now. So I think that's really the only thing I would change, because like I said, most of the foods that we provide are costly because of, you know, the types of food that we provide. But, you know, that's really the only thing. I mean, other than that, it's a great program.
Great. And Teresa and Orlean, anything else other than rates that you would change?
I agree with Shernette. The rates are ridiculous because I'm looking at my rate sheet and we get reimbursed $1.33 for breakfast, $2.49 for lunch, and supplemental meals are 74 cents. That is an insult, because if you're expecting us to provide high quality meals and nutritious meals, everyone knows these things are not cheap. So that rate is ridiculous. So yes, I agree with Shernette. The rate of reimbursement has to increase.
Okay, so something to advocate for. And Teresa?
I would just love to see, and I think my vendor's great. I would just love to see more South Jersey vendors on their list, as well as see those eligibility applications for the parents go away. I would love to see it area eligible for CACFP, just like SFSP is. Let's streamline it a little bit for the sponsors. You know, if we're in an area of need, do we really need to have all that documentation? If one program can do it, why can't the other?
Great. And our last question, I was going to ask you about, do you recommend this? And I think that's pretty obvious. You're all saying you would recommend participation. But so I'm going to change that up to, what is your tip for someone that wants to get started? What are one or two things you would say to a child care center that wants to start right now? I'll go to Orlean again.
I apologize. I'm sorry. I just was distracted. I just heard something troubling about one of my children in the daycare. I'm sorry. Could you please repeat your question?
I'm sorry. What would be your tip or advice for a center that wanted to get started?
With the food program?
Yes.
I would say do it. One thing I would definitely advocate is have a buddy system. I would say connect with another provider who is in the program and have them help you with the paperwork. Because for some of the providers in my area, I'm a shop steward, and a lot of the providers are dropping out of the program because the paperwork is cumbersome. They really don't understand how to complete it. Sometimes the inspectors are not quite as patient, and you can be penalized pretty heavily if your paperwork is not up to standard when you have an unannounced inspection. So, so I believe that buddying up will definitely help providers understand the program better, understand how to manage your time so that your paperwork is always up to standard, so that you're not being fined or run the possibility of being kicked off the program if an inspector comes out and your paperwork is not up to par. So that's one thing I would definitely recommend, but I would 100% say go ahead and do it. It's really great.
Great. Okay. And Teresa?
No, I think that's a great recommendation. That's exactly what I was going to say. Reach out to people, reach out for help. The reps from the state, I mean, I know my rep has always been there. Whenever I call, and I said I've been doing this for 14 years, I still forget. You get onto that portal and you're looking and going, all right, where is that at? They're always accessible. I have never, ever sent an email that hasn't gone unanswered. So there are people out there that are willing to help, whether it's a sponsor, one of your local child care organizations, that somebody else would be in the program, or the state itself. I mean, they're there to feed the children just like we are. So,
Great.
And that's what it's about.
Thank you. And Shernette?
And again, I agree with Arlene. Buddy up. I have a providers group that we meet once a month, and over the course of the month, whatever issues come up, whether it be with just general, like you said, the inspections or whatever the case may be, even when it comes to meals, coming up with ideas on different types of meals that are interesting. It's always good to have a group, because you feel more at ease when you know there's someone else who's going through the same thing you are. So again, like Arlene said, definitely a buddy system, a partnering system where you can talk to someone, where you can educate each other, is definitely the key to really get through. And throughout the being a provider or an owner, for that matter. So definitely, buddy system is a must.
Okay. And finally, Khadijah.
Yes, I agree. Definitely partner up. If you're still skeptical, just become a site and spend a year being a site under a sponsor. That way you can, learn more about the program, but definitely have a support system. Reach out to the veterans of CACFP, and, definitely don't be afraid to reach out to your specialists and ask questions and do your research. But you definitely need a support system, because like they said, it's a lot of administrative work and just training and, different things that you need to know. So if you want to just become one now, definitely become a site under a sponsored organization and spend the year just educating yourself.
Great. Thank you so much, everyone. And thanks to our panel today.
That was so great. And thank you so much. But thank you especially to our child care providers who we know took time away from their programs to provide their expertise and experience. It was invaluable. Thank you so much. And thank you, Suzanne. We definitely learned so much from them, and certainly some next steps to advocate for CACFP, as well as some maybe next steps to provide supports for those participating in CACFP. Okay. So we know and we learned today that through CACFP, children from low-income homes receive proper nutrition, meals, and snacks at their child care programs who are already participating. But most importantly, CACFP also improves the quality of childcare while making it more affordable for families who would otherwise have to buy or prepare those meals and snacks themselves. And we know and we heard that providers also qualify for reimbursements for the meals and snacks they serve. So, and as we heard from the panel, which I thought was so great, it's also a great way to encourage parent and family engagement in your program through workshops, and that ultimately supports healthy eating habits at home. We want to let you know that unfortunately we had quite a long but very plentiful information today, so we don't have time for questions and answers right now. But if you have questions about today's presentation, you will get the presentation emailed to you if you registered and participated through Zoom. But you can also email me. My name is Dani Glover, and I'm the Policy and Outreach Associate at the Advocates for Children of New Jersey, and my email address is there, and we can also share it. But as I mentioned, it will be available on our website as well. And we'll also be posting the webinar on our website, and you'll be able to access it on Facebook. But most importantly, many thanks to all of you who took the time and participated today. I know everyone's time is crucial, and we have back-to-back Zoom meetings, so I really appreciate you participating today to learn more about CACFP and its importance, not only for our state but in our local communities for our children. And I also wanted to thank our incredible collaborative partners, Hunger Free New Jersey, the Reinvestment Fund, the Department of Agriculture, the YMC State Alliance, and the Robert Wood Johnson Foundation, but especially to Teresa, Orlean, Khadijah, and Shernette. I thank you so very much. And that concludes our presentation for today. So thank you so much and have a great day.